All right, day 5. Today is all about foot care. We often neglect or don't think about exercises for this area enough, but we put a pounding on our feet day in and day out. Today is all about showing some tender loving care for your feet so they carry you through the rest of the day. So let's begin laying down on our backs. I'm going to choose to use a pillow today, so if you haven't days past, feel free to do so. If you don't want to, that's fine. Just make sure your neck and head is well supported and comfortable today. We're going to start with both knees bent, feet flat to the floor, and from here we're going to do basically an ankle pumping action. We're going to progress this through a series of movements. Arms just comfortable. I'm going to let my fingers interlock and rest my palms on my belly so I can focus on my breathing through this. So as I take a nice breath in, and on the exhale, I'm going to rock onto my heels to lift the balls of my feet and my toes up. I'm kind of spreading my toes wide to try to get my toes to touch my shins is the thought behind this, and relax back down. Should feel a little tightness in the front of the ankle. You may feel some in the Achilles tendon, in the calf. Pull the balls of the feet up again. And just holding it for a breath cycle. And back down. One more time. Rocking to the heels. Keep the knees about shoulder width apart. Feet in the same position. We just don't want to change the angle through the lower extremity because it does influence the stretch you may feel. And then drop the feet down. And then one leg at a time. I'm going to start with my right leg. I'm just going to lengthen my leg back to the bed, straighten the knee, and now the opposite leg. And now from here, I'm going to gently keep my feet facing upward to the ceiling, and I'm going to pump both ankles back toward me again to stretch the back of the calves, those gastroc muscles, and then point away as if you're pushing a gas pedal. Toes can flex down. And then we're going to bring it right back up. Pull the ankles toward you. Bring the toes as well to get a nice stretch. And relax to point down. And one more time. Just a nice basic ankle pump. Also has good relevance for getting the blood flowing, the venous system that returns the blood up. So it can help with swelling or edema if you have that in your legs. A lot of us spend a lot of time in gravity-dependent positions, standing, seated, so it's a great way just to get the blood moving. Now from here we're going to take the right leg and bring the knee toward the chest. Interlock the fingers behind the thigh toward the crease of the knee. Hold that hip at a 90-degree angle. Shoulders relaxed, elbows tucked into your side. And from here we're going to straighten the knee just like we've done before in our lower back program, but we're going to keep that leg extended and just pump the ankle. Increase the calf stretch as you pull the foot and toes toward you. Relax it to lessen the stretch, and then right back to it. Let's do 5 of those. And relax. 3 more. Pull it towards you. And pump away. 2 more. Pull it toward the shin. And relax. Last one. And relax. And then bend the knee back down. We're going to change hand position to bring it to the top of the knee, and we're going to take the knee to the right or lateral to the right shoulder. So creating a little bit of a hip external rotation position. I'm going to take my left hand and grab the right ankle to pull it in towards me some and open that hip. This is going to be important as we progress through this program to help with stretching certain areas through the hip, through the lower leg, and into the foot. And just hold it, take a nice breath, and relax. And then we're going to bring the leg back to center, ease it down. Let's straighten the right knee flat, bend the left knee up. Just a nice heel slide for comfort, and then lift that left foot off the table, off the bed. Knee to chest position, interlock behind. And from here now we're going to straighten the left knee. Remember to keep the shoulders and elbows kind of tucked in and relaxed. Reduce the strain in the upper body. Keep the knee straight and pump that left ankle. Pull it towards you to feel the stretch in the calf. You may feel a hamstring pull as well. Ease off, right back to it. And relax. 3 more. Pull it towards you. Try to keep the mid part of your foot in line with the mid part of your shin. For this, nice neutral ankle position. Good. Let's do 1 more time. And relax, and then just slowly bend the knee down. Take the left hand to the upper left shin and pull the left knee toward the chest, but aiming lateral and kind of wide of the shoulder. Right hand comes to the outside of the ankle to rotate the hip, and then gently pull that in to kind of massage into that hip. Just nice and gentle with this again. Just waking up the hip. And then come back to neutral, foot down to the bed. From here now, let's bend the right leg back up and see if we can come into a clamshell posture. It's basically an opening hip position. So we're going to bring the feet so they touch. Kind of give a foot high five here. And then let the knees just fall to the sides. So kind of falling laterally or opening up. You can take the hands and place the palms on the inner thigh and just let the weight of the arms add some gentle stretching. I don't want you arching through your back with this a lot to try to go further down. So just let it go comfortably. If you have extra pillows around and you can't let it go too far, you could always take a pillow and place it between the bed and your knee for support or for comfort here. That's perfectly fine. Let's just kind of hang out here for a few seconds or a couple breaths. Just let the groin and the hips stretch. Press the feet together through the heel, through the balls of the feet, and then gently just separate the toes. Good. And then relax. And then let's do that 1 more time. Heels stay together, balls of the feet press together, and separating those toes away. Stretching the arches of the feet and relax. Let's bring the knees back up to neutral so they touch. Roll onto your side. I'm going to roll onto my left side here so I can face you. Slowly press up and then coming feet to the floor, or again, if you have a bed frame and you want to prop the feet or a little footstool, that's fine. From here now, we're going to cross one ankle over the opposite knee. So I'm going to take my right ankle and bring it just over top of that left knee, maintaining a good upright seated posture if I can. If you can't quite get here, we can always straighten the left leg slightly and take it just below and just work some active movement. But we're going to do a passive stretch for the toes and into the plantar fascia, the arch of the foot. So we're going to cross the right ankle over the left knee, take the left hand, and I like to make kind of a C shape between my thumb and my first finger, my index finger, and cup around the heel of the foot. And then I'm going to take my right hand and keep all the fingers together and place it right across the ball of the foot and really encapsulating those toes at the same time. And I'm going to gently use my right hand to pull the right foot towards the shin and push down with the left hand. So it's kind of a counter pressure here. And just take it to where you stretch it. Getting the toes involved is really, really important. A lot of people that have kind of bottom of the foot or plantar foot pain, plantar fasciitis or fasciosis, a lot of terminology that we use for these things. Putting weight through the feet first thing in the morning is often very, very painful. So this is a nice way before you get out of bed and start to weight bear to add some stretch. Just relax that. Let's do that 1 more time. You could always do this laying down as well. That's why we did that hip rotation stretch to kind of build into this. And relax. And then uncross the right leg, put the right foot back to the floor, and then let's bring the left ankle over top of the right knee. I'm going to take the right hand onto the left heel, left hand onto the ball of the foot, again getting the toes involved onto that, and I'm going to gently pull with the left hand to dorsiflex or that movement toward the shin as I push down and away through the heel. And just holding that anywhere from 10 to 30 seconds is fine, however long you want to do that. Today we're just going to take a nice stretch and ease out, point down, and one more time coming up. But feel free to deviate from these stretches. If it feels good, continue. That's my advice. And relax. And then let's uncross the leg. Come back down. Let's come to standing. So we prepped ourselves to now put some weight through. From here, we're going to turn around and face the bed. Let's place the hands on the bed and just get it towards a comfortable position. If this is hard on the wrists, you could always go fists. That's fine as well. But we're going to step back and keeping the feet close together if you can, just slightly inside shoulder width. Keep the heels flat to the floor. Straighten the knees and gently just let your body fall forward towards your hands. Fight that urge to want to let your heels come off the floor. The more we keep the heels down, it's going to give us a nice calf stretch. There's two muscles that form our Achilles tendon. So for Achilles tendon problems, tendinitis, tendinopathies, this is a really nice stretch. You could always kind of flex and just feel it out to alternate bending one knee at a time to get a nice stretch here. On a single leg, if doing both together is too much. And then from here, just use your hands to push your body back to stack the hips over the ankles or toward that position. You might get a nice stretch in the shoulders with this, but just trying to take weight off of the legs for a minute or off the Achilles tendon. And then one more time, keeping the knees straight, heels down, shift forward again. Nice calf stretch. Use your discretion with this. Again, if you want to alternate knee bending, isolate one leg, that's perfectly fine. And then push back. Just alleviate that pressure. This is kind of our modified downward dog position in yoga. And now from here, as we weight shift back over the hands, keep both feet facing forward, feet stay flat to the floor. Bend the knees and kind of drop down and in. If you need to, you can step a little closer to the bed with this, and you may have a little more range of motion down and in here. As long as the heels stay flat, you're going to feel a stretch in the front of the ankle, most likely, or down low in the Achilles tendon. Keep the knees in line with kind of the second toe with this. And then just straighten both knees. You can push back slightly, take the pressure away. One more time coming forward over the hands and wrists. Press the fingers into the bed if your palms are flat to take some pressure off the wrists. Keep the heels down as we bend both knees together to feel that nice deep stretch into the Achilles tendon and into the ankles. And then gently just kind of straighten the knees and press back. Walk in toward the bed, slowly come up to standing, and from here, let's finish working on controlling arch height position. Most folks, I would say, tend to go more flat foot. Some people are the opposite and they have a really high arch. But from here, if we keep the feet shoulder width apart, feet flat into the floor, I want you to gently think of rolling just the ankle joints. We're not moving the whole leg. We're not doing everything through here. Small, subtle movement at the ankles. Take your feet into a foot flat position or a pronated position, and then we're going to roll toward the pinky side and raise that arch height into a supinated position. Big toes stay down. Don't go far enough to where your toes come off the floor. Let's do that one more time. Roll flat, and then rolling up to a nice tall position. This helps to prep the musculature through the rest of the legs, the hips, the buttock, the lower back, to really help take pressure off of the feet. Great job today. Keep this practice going. I'll see you tomorrow. Excellent work.